So the first thing I'm going to do is check the medical chart. I'm going to perform hand hygiene. I'm going to gather my materials. I'm going to put on PPE if indicated, and then I'm going to have the patient come in the room. And as they're walking, I'm checking their gait, and I didn't know any limps or unsteady gait at all. So the next thing I'm going to do is provide privacy. I'm going to explain to the patient that I'm doing an assessment on them today. I'm going to identify them with two identifiers. What's your name?
Emily.
Date of birth?
10/26/97.
Okay. So the first thing I'm going to do is assess her posture and making sure that she's comfortable, that she's not slouched over. I'm checking her mood, making sure it's appropriate for the situation. I'm also checking her facial expression, making sure she's not in any distress or panic. She seems comfortable. I'm also assessing her grooming habits, if she's clean, if she smells, if she looks like she takes proper care of herself. So that's good. I'm making sure that she's dressed appropriately for the season. I'm making sure throughout the whole assessment that her speech isn't slurred, it's clear and understandable, and then I'm going to gather subjective data. So have you had any surgeries to your nervous system? Are you dizzy at all? Have you had meningitis? Any tingling or pain in your muscles? Okay. So if I had any concerns, I would go further into subjective data, but there's not much to expand off of, so I'm going to leave it as B. So the first thing I'm going to do is I'm going to have you face me, and I'm going to have you shrug your shoulders. So cranial nerve 11 is intact from her shrugging her shoulders. She didn't have a problem with that. So I'm going to have you push your face against my hand. And then on this side. Okay, so that was good. I'm going to have her stand up. I'm going to do the Romberg test on her. So I'm having her put her feet together and close her eyes. And I'm going to note any wobbling or unsteadiness. She seemed fine, so you can go ahead and have a seat. The next thing I'm going to have you do is do the finger to nose test. So I'm going to have you touch your nose and touch my finger every single time I move my hand, okay?
Okay.
Okay. So that seemed good. She did it properly and she didn't have any difficulties. So the next thing I'm going to have her do is I'm going to have her lay down. And I'm going to assess her feet first so I can get her lower extremities done. And then I'm going to move up to the upper extremities. So I'm going to have her do one leg at a time. Sorry. And I'm going to have you push up. And then push down. And same thing with this one. Okay. Okay. Then I'm going to have you push against my hand. Okay. Okay. And then like a gas pedal. Okay. Okay. The next thing I'm going to check is the Babinski reflex. So what I'm looking for is if she doesn't have any toe movement, it's okay. And if her toes curl up, so if her toes bend down towards the bottom of her foot, that's a normal sign. If her big toe will bend back and the rest of her toes will fan out, that's a bad sign. So that's really what I'm keeping an eye out for. So what I'm going to do is 3 different methods. I'm going to go up the foot, up the side of the foot, and horizontally across the foot. So I'm going to go up the foot, the side of the foot, and across the foot. Up the foot, up the side of the foot, and across. So everything was normal. The next assessment I'm going to have her do is the heel to shin. So I'm going to have her start down here and pull up. Okay, and the same thing with the other side. Okay, so her lower extremities did good. The next thing I'm going to assess is her upper extremities. So I'm going to have you grab my fingers and then push against me and pull against me. Okay, now I'm going to have you sit up for me. Okay, so the assessment went well. Like I said before, the cranial nerve 11 was intact and the cranial nerve 8 was intact. If I had any issues, I'd go back and assess further and make sure the patient's comfortable, they don't need anything, make sure the call light is in reach, and perform hand hygiene. And that is it.